Synaptica is developing a totally new way of treating Alzheimer's. It's a drug-free, non-invasive neuromodulation approach. It's focused on modulating a new network in the brain that we've identified that's associated with episodic memory, and we're strengthening the network by inducing neuroplasticity in that network. We're basically counteracting the disease process of Alzheimer's by strengthening the neurons in the network and thereby bending the progression of the disease. And we're showing 82% slowing of the disease in mild to moderate patients in 6 months. Really incredible result. In my view, it's unprecedented. So we published Phase 2 clinical trial results, sham-controlled, double-blind, 6-month results in the prestigious journal Brain, which is out of the Oxford University Press. So we feel really good that that's a solid proof of concept study. It's a landmark study. Haven't seen anything like it. First, we did a TMS EEG personalization, and then we did daily induction sessions for 2 weeks, followed by weekly stimulation for 25 minutes, out to 6 months. We looked at all the right endpoints that you would expect to see in a pivotal drug trial today, and the results were a profound success. On the primary endpoint, CDR sum of boxes, a gold standard cognitive and partially functional endpoint, we slowed the disease of Alzheimer's by 82%. And then on ADAS-Cog and MMSE, which are also 2 other endpoints associated with cognition, over 80% slowing of Alzheimer's disease. On ADLs, we actually arrested the progression of the disease, 100% slowing. You never see that in pharma studies today. ADLs is what really matters. This is the difference between my mother needing a nursing home or me keeping her in her own home. We're full steam ahead towards pivotal. We believe that we can march forward with this data and replicate it in a multi-center US-EU study with a 1-year endpoint potentially that will make this state-of-the-art therapy available to patients in the US first and around the globe thereafter. If the phase 3 approaches anything like the phase 2 data, it's going to represent one of the biggest breakthroughs in Alzheimer's disease in over 20 years. We know that patients can't wait another minute.